sprains. We've all done them. Twisting your ankle, rolling your ankle. It's one of the most common injuries in the general population, let alone with dancers. And we're going to see why, as dancers, we can be particularly vulnerable to this type of injury because of the way we use our feet. But often I see dancers who had an ankle sprain that had nothing to do with dance. They did it on the street, on a paving stone, and it's then affecting, obviously, what they're doing as a dancer. But it's not always dance that is the cause of these sprains. Now, that word sprain, that term always refers to ligament injuries. We talk about ligament sprains. If you see the word strain, that refers to muscles and tendons. Go and watch the Meet Your Soft Tissues video that will talk you through the difference between muscles, tendons, ligaments. And then also look at the videos on the foot anatomy and the ankle anatomy to give you the context to understand how these injuries occur and which structures are involved. Now, with ankle sprains, there's a lot we need to do in terms of rehabilitation management. So I'm doing two parts to this topic. This video is going to take you through the theory, the anatomy, and why these things happen, and a little bit of the management. Then in the second part of the video, I'm going to be working with a dancer, showing you some functional things that you can do for rehabilitation of an ankle sprain. Okay, let's have a look first at the ankle area, and what are we talking about when we say the ankle? If we look at the location, the geography of the ankle, in the lower leg there, you've got two bones, your tibia, which is the big main chunky shin bone, and then you've got the fibula, which is that little splint bone that runs down the outside of the lower leg. Underneath that, you've got a bone called the talus or talus, and that sits underneath the little archway made by the ends of both the tibia and fibula. Now I'm just going to set this little 3D animation spinning, and you can see now exactly the architecture of that ankle joint. The big bone coming down there is your tibia, your shin bone. The little bone coming down is the fibula, the little splint bone. The two of them form a sort of arched ceiling, if you like, and the talus is sitting underneath that. And when we point and flex our foot as we're moving through space, that talus rolls forwards and backwards underneath that little archway. Now, your ankle bones, you all know where those are. You can put your thumbs on them. What you'll note here is that your inside ankle bone is on that tibia. That's the big shin bone. The outside ankle bone, see it spinning past there, is on your fibula, the outer splint bone. People don't often realise that their two ankle bones are on different bones. And what you might also notice from this picture, particularly as that back view comes around again, is that the fibula, that little splint bone, the ankle bone is lower down than the inside one. And you can try that. If you stick your thumbs on your two ankle bones, you'll notice the inside one's a little bit higher than the outside one. Why is that important? Well, it kind of gives us a clue as to why typically when we injure our ankles, roll the ankle, we roll it outwards, right, towards the outside of the foot, and that heel bone is going to roll inwards as we do that. You can imagine if that big heel bone you see at the bottom there, the calcaneus, if that's rolling under you as you tilt off that paving slab or land awkwardly from the jump, because that inner ankle bone is higher, there's more room for it to go. So there's more instability in that direction. However, if you were to roll the ankle the other way, so that heel bone is flicking upwards, say you're falling inwards towards the middle of the body, then that outer ankle bone, because it's lower down, kind of blocks the movement. There's not as much place for us to fall into in that direction. So those types of ankle sprain are more rare. And we'll look at both, but we're going to focus primarily on that inward rolling, which is known as an inversion sprain. Let's take a look. Inversion is the motion of the foot rolling inwards that way. If you watch the foot and ankle anatomy videos, we'll talk about the names of these motions. Eversion is the opposite way, when you go outwards with the foot on the ankle. Now, an inversion sprain is our most common one, and it's involving, if you look at that lateral view image there, lateral means on the side, the outside of the body. So we're looking at the outside of someone's right foot and their outside ankle bone. And you'll see we're going to be looking at the 3 ligaments at the bottom of that image, and we'll look at the upper 2 ligaments later on. Those are all kind of crazy names. We're going to break those down. They're not as complicated as they sound. But let's first have a look at the different levels of severity of injury that we can have with our ligaments. Ligament injuries are categorised as grade 1, grade 2 or grade 3, depending on how bad they are. In that grade 1 image there, we're talking about damage to the ligaments that's relatively minor. That's your basic little, I kind of crank the ankle over, feels a bit bruised and nasty and sore for a few days, but then it kind of calms down. That would be your grade 1. Now, when the fibres are damaged, they're actually getting torn. But in a grade 1, you're looking at really at a sort of, could be just at a microscopic level. The word tear sounds quite dramatic, but you could just be snapping a few of those fibres. They're a bit like strands of hair, if you think of them like that, and you might have just snapped a few of them. We're only looking at, a small number of the fibres being torn if you're getting a grade 1 injury. When we get to a grade 2 injury, we're really looking at a little bit more damage here. Anything up to 50% of the fibres have become torn. And we're going to start noticing we're getting some instability at the ankle here. Remember, ligaments' job is to protect the movement of the joint. They're soft tissue, but they're not stretchy like a muscle is. They have a little bit of give, so it allows for some play in that joint, but they're there to stop you from going too far. However, if you put a load of force through them, like you're falling onto that ankle, then those fibres can tear, and therefore we're losing the stability of the ankle. And because they're not like a muscle that'll spring back again, we've now got what we call permanent laxity at that joint, which we need to offset with our rehabilitation training. We'll get into that. So grade 2, a little bit more damage, a little bit more instability. Grade 3 is really where we've torn the whole thing. We call that a rupture. And that's where you've torn the full thickness of the ligament, and now we've got quite notable instability at that joint. We're going to also talk later on about those grades of injury in terms of their healing times, because the different grades have longer healing times. Obviously, the more severe the injury, the longer it takes to heal, but we'll get into that a little bit later. Let's now zoom in and have a look at the 3 ligaments I mentioned there that are most commonly involved with your inversion sprain. Now, we'll break down the names here because they're not as complicated as they may look at first glance. And we're going to look at them in order of severity of injury. So if you just do a mild roll of your ankle, typically only one of the ligaments gets involved. And then if it's more severe, 2, and if it's more severe, 3. The first one to get involved in any of your ankle sprains is the ATFL. We like to shorten all these things down because they're too long to say. But what that stands for on the far right there is your anterior talofibular ligament. Okay, anterior just means on the front of the body. So it's the one on the top front of your ankle. Talo, we looked earlier at the talus bone, that bone in the middle of the ankle. Fibula is the splint bone that becomes your outer ankle bone. So the anterior talofibular ligament is the ligament that attaches your talus to your fibula on the front of your foot. Not that complicated. All right, so that's number 1 that can get involved in an ankle sprain. If you rolled it a little bit more and kind of cranked that heel underneath you, then the second one to get involved is the calcaneofibular ligament. Your calcaneus, if you've watched your foot video, is the heel bone, the big chunky heel bone that we stand on most of the time. Calcaneofibular, it's running from the calcaneus to that outer ankle bone, CFL for short. So that's number 2 that gets involved. Then you've got a third one that's tucked around the back of the ankle, back, posterior, right? So the posterior talofibular ligament goes from the back of your talus up to the back edge of your fibular ankle bone. PTFL for short. So that one's much less likely to get involved, but if you really kind of crank the ankle with a lot of rotation, that one can be involved too. So ATFL first, followed by your CFL, followed by your PTFL. As a practitioner, I can do different tests to assess which of those ligaments have been involved. We do that by testing the stability of the joints that they connect. Now, there's one thing that we also need to be mindful of when we do an ankle sprain, and that's, have we got an ankle fracture involved here too? Not very common, but it can go hand in hand with an ankle roll if you've really fallen hard on it and got a lot of body weight and momentum behind the ankle roll. There is a risk that you might have broken one or more bones. So this is something that we need to be able to assess and at least eliminate from our findings. The bones that can get involved, the tibia or the fibula, and typically with an ankle roll that might be around that inner ankle bone, if you like, on the tibia, or it could be a fibular fracture around the outer ankle bone. The word malleolus is the fancy anatomical term for your ankle bone. So your medial one is towards the middle on your shin bone. The lateral one is towards the outside on your fibula bone. So those could be involved if you've really kind of cranked, and particularly if you've fallen like off a paving stone or something, so you've actually dropped the ankle a bit further. Another type of fracture that can happen that's not quite as severe as those is what we call an avulsion fracture. This is where a bit of bone, just kind of a little piece of bone, has been pulled away. So in this case, in this image we've got on the right there, the X-ray, we're looking at that fibula, the outside ankle bone, and you'll note just at the bottom there, a bit of that bone has come away. Remember, that's where that calcaneofibular ligament attaches. Sometimes, depending on the angle that you fall at, the ligament can actually pull away a piece of bone. So actually the ligament's still intact, but it's pulled away a piece of the bone, so it's no longer attached, but it's the bone that's not attached to itself rather than the ligament not attached to the bone. That's an avulsion fracture. Now, when this occurs, or if this occurs, typically, as I say, you've got a lot of momentum behind the fall or the roll, and often there's an audible pop or crack when this happens, and you kind of know, it's like your gut goes, oh, that's not good. That was something more than just a general roll. However, you can still get sounds, popping sounds with just a ligament injury, so it might not be that. One of the things that we often use as a marker of whether there may be a fracture involved is whether you can weight bear more than 4 steps. So if you're not able to walk up to 4 steps, put your weight on that foot, you need to get it assessed for a potential fracture. Really, if there's any doubt, go and get an X-ray or go and get an assessment from a medical practitioner. There are some techniques we can use without X-ray to assess for likelihood of a fracture, but you at least want that off the table before you begin your rehabilitation process. All right, let's have a look now at the mechanics of how this injury typically occurs within the context of us as dancers. Now, the ankle joint is very stable at its end phases of movement. So if you're standing or in a plie position, there's sort of a lockout that happens at the ankle. That talus is held quite securely in its little archway. Similarly, If you're in the fully pointed position, so if you're a classical dancer standing on point, or if your foot is fully pointed in the air, say in a jump, again, there is a sort of locking mechanism that actually makes that quite a stable position. However, what is unstable is when you come out of that fully pointed foot, going down to sort of that half or 3/4 point position, a rise position essentially. That's when that talus bone becomes unlocked from the joint, and now it's vulnerable. There's a lot more play in that joint. So typically, if you think about it, if you're flying through the air in a jump and you've got your foot pointed in the jump and you're coming to land toe to heel, remember as dancers, we don't use the natural heel to toe motion. We typically use toe to heel motion when we're landing from jumps. As you're coming down, you've got that foot in a pointed position. As you come down to that 3/4 point position, you unlock the ankle, and whoa, if you're not landing dead straight with your body weight coming straight down, you're at a slight angle, or you've landed more towards your little toe, then the ankle is unstable and you're more likely to roll it. That's what we would call a sickle position. So if you're somebody that gets a lot of corrections for sickling your feet, that's a risk factor for this type of injury, because if you're sickling your feet all the time, particularly in a rise position like you can see in the bottom right there, you're actually stressing those ligaments. Remember, you've seen where they sit on that outside aspect of the ankle. You've been stressing the ligaments. They can start to become lax. Remember that term, they're loose. They're then not providing the protection around the joint that they used to. And then you're more likely then to roll that ankle if you have an awkward jump landing or walk on an uneven paving slab. This is why we need to be really mindful about making sure we're keeping those ankles in nice neutral alignment and we're building strength in that position, so we are protected against this type of injury occurring. Now, we've talked about the ligaments there, the primary things involved in an ankle sprain, but there are always muscles involved. You can't really injure one thing in the body. There's normally a bunch of other things that are involved in this type of injury. We're going to look at a couple of muscles that are particularly important and also important in our rehabilitation phase. Remember, if we've damaged a ligament, you really can't do much with that in terms of making it go back to how it was. We need to get these muscles fired up to help stabilize the instability that has occurred as a result of the injury. On the left there, we've got the tibialis posterior. Remember, these are just map references, these funny names. Tibialis, it's a muscle that runs down the back of your tibia, right? Your shin bone. Posterior, it's on the back of your tibia. If you imagine on that picture, we've taken away your calf muscles, your big fleshy calf muscles on the outside. We're looking underneath the 2 layers of calf muscle. Go and watch the ankle joint video to see those. And you can see it runs down the back of your lower leg, and then its tendon, remember muscles end in tendons, wraps around that inside ankle bone and comes underneath the foot. Its job is to pull your foot into that sickle position we just talked about. So it inverts the ankle. If you've rolled your ankle into that inverted position in your injury, then the muscle might have got tightened up in the moment of injury. Muscles often go into what we call a guarding or bracing mode when we go into an injury, because they're trying to kind of decelerate us and stop us and protect the joints. As we fall, they lock up and spasm, and if you're going into that inverted position, that tibialis posterior could shorten up in the moment of injury, but it doesn't have an off switch. So unless you actually unlock and release up the tension in that muscle, it can keep wanting to pull your foot inwards. Then guess what? You've now got more risk of going into that unstable position. We need to make sure that we've cleaned out and rehabbed that tibialis posterior muscle so that it's not leading you down the garden path to a recurrent injury. On the other side, we've got muscles that pull the foot outwards, what we would call winging or fishing in dance, where the front part of your foot is swinging outwards towards the outside of your ankle. These muscles run down the outside of that fibula bone on the outer part of your shin. So if you prod down that outside, often it's quite tender. And we've got a peroneus longus, because it's a long one, that runs all the way down that fibula bone, and a peroneus brevis, a shorter one that starts a third of the way up your ankle, and they both come around the outside ankle bone. They're running around the outside of that fibular ankle bone there. So they can get wrenched as you go over, they might get a little bit of strain through them, the tendon might be damaged. So those also need to be addressed when rehabbing. We're going to be really recruiting those muscles. They are the everters, the wingers of the foot, because they're going to be really helpful in offsetting any laxity that's come from damaged ligaments. Okay, that was the sort of architecture of what is involved in your regular common or garden inversion sprain. We're just going to briefly look here at a couple of other types of ankle sprain. These are much less common, but they do happen. So let's have a look at first a high ankle sprain. We looked before at those lower three ligaments. With the high ankle sprain, we're actually looking at these two ligaments that are a bit higher. Now again, long names, but perhaps you can figure them out. The anterior tibiofibular ligament, so that goes from your tibia to your fibula, so they're above the ankle joint itself. Obviously that one's on the front, and on the back, the posterior tibiofibular ligament. So they're really there to keep those two lower leg bones in concert with each other, help them work together. What you'll see on the far left there is something called the interosseous membrane. Again, fancy name, but inter means between. Osseous, os refers to anything to do with the bone. So it's a membrane that runs between the two bones. So that tibia and the fibula in the shin have a membrane between them, because as we're moving through space and we're twisting and rotating, those bones need to be able to kind of shift on each other, but we don't want them to move too far. So that membrane allows them to move a bit, but stops them from moving too far. Spraining these structures typically involves a situation where your foot is in a turned out position, so classical dancers in particular can be vulnerable to this. Say if you're landing from a jump in a turned out position and you've got forward motion, so your body weight's coming forward and you over push and you land, and often our feet, as you know, can get kind of stuck, like the shoe or your bare foot can get stuck to the dance flooring. You keep pushing and rotating, but the foot doesn't. And then you've got this shearing motion that can twist those two lower leg bones. But what can also happen is the talus bone in the middle of that archway can kind of push up a bit and roll forwards, and it tries to separate those two bones. It's kind of squeezing them apart. And therefore those higher ligaments and that interosseous membrane can be involved in that. We can also get fractures involved in that type of sprain, and typically the fractures are a little bit higher as well. The medial deltoid ligament sprain involves another ligament. Now here we're looking at the inside of your foot and that inside ankle bone. From that inside ankle bone that's on your tibia, you've got a little fan of ligaments. They are individual ligaments. They do have their own little fancy names, but we tend to clump them together as a group, and typically they get injured together as a group. This kind of injury could be involved with your high ankle sprain because it comes from that inward rolling of the foot. But they can also just get damaged on their own. And if you are somebody who gets corrections about rolling your feet, if you like to kind of roll, we call that overpronation. Go and watch the video on rolling. We're stressing and stretching those ligaments over time. And again, if you're putting forces through ligaments over time, they start to become baggy, then they're lax, then guess what? You're more likely to roll in. And if you have an awkward footfall, particularly in a turned out position, you could roll and sprain these ligaments as well. Remember, it's a little more protective because that outer ankle bone is going to stop you from rolling too far, but they can get in trouble, particularly if you like to roll. So don't do that. Watch the rolling video and I'll show you how to address that issue. Okay, what do we do? Acute management. So acute refers to an injury that's just happened. Normally the acute window, as we call it, is the first sort of 24 to 48 hours after an injury. You're in class, you've done your big leap across the room, you landed awkwardly, you went over on that ankle. What do you need? And you know something went horribly wrong. What do you need to do? We typically go straight for that RICE procedure, RICE. That stands for rest. Doesn't mean lie down and have a nap, but it means get off it. Stop weight bearing on that ankle. Ice, we really want to get some ice on it relatively quickly. And we want to use something like a gel ice pack or a bag of peas even. Something that'll mould and shape to the ankle. The ankle is bony and you've seen those ligaments are little tiny sort of straps. If you just had something solid, you wouldn't be able to actually target that ice around the structures that need it. So something that can wrap around your ankle is most useful. Compression, we ideally want to wrap that ankle, and we can do that around the ice pack, or once you've removed the ice pack, you can wrap the ankle. That's going to restrict some of the swelling that occurs. You all know if you've done this, these things can blow up like a bit of a balloon. The body is throwing a lot of healing ingredients down to that ankle. Remember, it's useful. Watch the inflammation video. The body knows what it's doing, but what we want to do is not let that get too exaggerated. The issue with our foot is it's on the bottom end of our body, and most of the time it's pointing downwards, right? It's at the bottom of our kind of tower block, if you like. The effect of the pumping mechanism of the heart, which helps drain off some of these excess fluids, is very reduced at the ankle. So by compressing it, we can help it not become like a bucket that's just filling up with fluid and it can't drain. Similarly, we want to elevate it for the same reason. And when we say elevate it, what you really want to do is get that foot up at 45 degrees above the body. So the best thing to do is to lie on your back and get the foot propped up on a chair or something with a cushion on it. It's going to help drain those fluids upwards because it's now higher than your heart. But also, we all know when we've done this, you can go into a bit of shock, right? You can feel a bit wobbly, you can feel a bit stressed, and you go into the stress response. Go and watch the anxiety video to learn more about what's happening in that stress response. We want to mitigate that. We don't want that to get too exaggerated. So by lying down, raising that foot, you're actually helping to calm down the heart rate as well. So rest, ice. Now with the ice, you really don't want to ice more than about 10, 15 tops minutes at the ankle. Watch the inflammation video to learn more about icing. But we don't want to freeze out this area. The inflammation is useful. It's bringing healing ingredients. We just want to turn the volume on it down a little bit, but we don't want to freeze out the ankle altogether. So 10-15 minutes, remove it, allow the area to warm back up to body temperature before reapplying. Compression wrap, as we mentioned, you can wrap around that ice pack, but make sure you take the ice pack out after about 10 or 15 minutes, and then you can wrap the ankle without it again. Then you want to go and get that assessed, ideally by a medical professional, particularly if you're not able to put weight on it in that sort of immediate time after injury. Other things to be mindful of that might mean you've got something more serious going on. Severe pain, I mean, they're always painful, but if it's like that, like throbbing, really kind of bad pain, get it checked out. Numbness, if you've got pins and needles, tingling, numbness in your foot, your toes, go and get immediate medical advice because we could have got some nerve damage in there and it could be indicative of a fracture. We've mentioned not being able to walk more than 4 steps. Also, if the bone areas are sensitive to the touch, obviously the soft tissues are going to be sensitive, but even if you press on your shin bones higher up above the ankle, if there's a fracture in there, they're going to cause what we call referred pain down into that ankle. So touching your lower leg bones above the ankle can tell you, if you give them a bit of a squeeze, it can give you an indication that you might have some bone involvement there. If in doubt, get it checked out. There's a rhyme for you. It's better to go and see someone, get that ruled out, than to miss something. Rehab, balance and strength is so key. Remember that ligaments, if you've watched the ligament video, they're very involved in our balance feedback mechanism. That needs to be rehabbed. We're going to get into that in our second video. Things like wobble board, balance training, what we call proprioceptive training must be a part of your rehab. And there's a whole video on balance training as well that you can go and look at. As we mentioned, once those ligaments are lax, they're not going to come back to their original strength. Therefore, we need to recruit the muscles in the area to offset that reduction of stability. Using resistance band is a great way of doing that, recruiting those peroneal muscles on the outside to get nice and strong and making sure we've got a good balance between the muscles that invert the foot and the muscles that evert the foot in order to keep that ankle bone in a nice neutral position. Watch the second part of the video where I'll demonstrate how to do all these things. Little bit on healing times. These are very approximate. It's going to be very unique to your particular type of injury, but typically those grade 1 injuries, what we call functional repair, that means when you're kind of back to full function in class, say, or performance, for a mild grade 1, 2 to 3 weeks, but the healing is still going on. And that's something dancers often miss, is just because it feels better and it's working the way it should, the tissues are still in their healing phase and you need to be mindful of that. If you've had a grade 2, then you're looking at more 2 to 8 weeks before you're back to sort of full performance. And structurally, you can be 3 months before those structures are really fully healed. If you're up to a grade 3, where you've really torn those ligaments, functionally you could be 3 months. Ligaments are slow to heal because they don't have as rich a blood supply as a muscle does. And structurally, really up to a year. I've seen people with ankle sprains who are still getting swelling a year later, even 2 years later. That's not uncommon, but functionally, you're normally back in action by then. But the body is telling you it's still healing. Okay, that was a little look at what's going on with our ligament injuries in the ankle. Watch part 2 and we'll go through some practical things that you can do to make sure that you take care of this once and for all.